Government has allocated 4.5 billion shillings in the 2021 budget to procure additional COVID-19 vaccines for the country. Treasury Cabinet Secretary Ukur Yatani says the country is also seeking a 5 billion shilling loan from the World Bank to finance vaccine purchase. So far, Kenya has received a little over 1 million doses of COVID-19 vaccines through the GAVI-COVAX facility at no cost to the Kenyan taxpayer. And as our very own Dorcas Wangira reports, nearly 4,000 people have so far been vaccinated across the country.
Kenya continues to vaccinate healthcare and other frontline workers in the first phase of the vaccination drive. According to the Ministry of Health, Wednesday, 4,000 so far have received the jab. Baringo County officially launched its vaccination drive today at the Baringo Referral Hospital, with the Baringo Health CEC Mary Panga being the first person to receive the jab in the county. Other counties that received the jabs today also include Kitui and Mandera. Interior Principal Secretary Karanja Kibisho and Police Inspector General Hilary Mutiambai led the security personnel in the vaccination campaign.
Further, to ensure transparency and accountability, this is where the ICT platform becomes extremely necessary. I will urge all Kenyans to take advantage of this opportunity and get this job in order to curtail the transmission as well as protect ourselves from the virus.
However, against this backdrop, financing, which is the encasing ball of all the vaccine interventions, remains crucial. Kenya, according to the Vaccine Deployment and Vaccination Plan, expects to receive 25 million doses of the COVID-19 vaccines from GAVI, an international consortium under the COVAX facility. This is at a cost of 20 billion shillings to vaccinate 11 million Kenyans. Of these, 1.02 million doses of the Oxford-AstraZeneca vaccine were received on Wednesday, 3rd of March, through the COVAX facility. Speaking before the National Assembly's Health Committee, Health CAS Dr. Mercy Mwangangi asserted that the vaccines received didn't cost the Kenyan government and the Kenyan taxpayer a single cent. However, under the National COVID-19 Vaccines Deployment and Vaccination Plan, the country requires 34 billion shillings to immunize 30% of the population, a cost to be shouldered by both GAVI and the government.
Is GAVI paying the source, or is GAVI placing money somewhere in the ministry or somewhere in this country? That support, where is it reposited?
It's a negotiation led by GAVI, as we're just receiving the vaccine in kind, along with the injection devices and the safety boxes. In terms of the 10 billion, that is what we are hoping to negotiate with World Bank in terms of credit. That has not been finalized. That's a process that's still underway in Treasury.
However, Kenya isn't only relying on donor provision of vaccines.
Kenya expects to receive vaccine support from GAVI to vaccinate another 20% of the population, and also self-procure vaccines for 10% of our population.
This plan is to purchase an additional 11 million doses, still from the COVAX facility, financed by the Kenyan government. This will cost 10 billion shillings to vaccinate 5 million Kenyans.
So the 11 million doses will only come in after we've exhausted the first facility of COVAX. So most likely that will be perhaps in the year 2022-2023.
This, the Health Committee says, is crucial to avoid over-reliance on donor funding. But where will this money come from? The government has allocated 4.5 billion shillings in the 2021 budget to procure COVID-19 vaccines for the country. Treasury Cabinet Secretary Ukur Yatani says the country is also seeking for 5 billion shillings loan from the World Bank to finance vaccine purchase, as well as capacity building and infrastructural costs. The additional 4.5 billion shillings will be in the 2022 budget.
The lack of resources to cascade the training and capacity building for healthcare workers remains a major challenge.
Even if we are going to provide during the next financial year, the budget will be ready by around August. Then, in terms of procurement process, another 2-3 months. Then it means even if we're going to avail the money, Kenyans are going to get this vaccination next year.
Kenya expects to receive a donation of 100,000 doses this Friday and the next consignment of doses from COVAX in 4 weeks, in time to give the second dose to those who have been vaccinated after the 8-week gap period between the first and second dose lapses. Dorcas Wangira, Citizen TV, Nairobi.